Hello there. In this video, we'll be discussing an important class of antibiotics, sulphonamides. Hello there. In this video, we'll be discussing sulphonamides were the first effective chemotherapeutic agents to be used systemically for the prevention and cure of bacterial infections in humans. Before sulphonamides were discovered, there were limited treatment options available for bacterial infections, and many people died as a result of infections that could not be treated. The discovery of penicillin, and subsequently other antibiotics, revolutionized the field of medicine and greatly diminished the usefulness of sulphonamides. Sulphonamides are a group of drugs that are derived from sulphonilamide, which is also known as para-aminobenzene sulfonamide. Sulphonamides are a group of drugs that are derived from sulphonilamide, which is also known as para-aminobenzene sulfonamide. These drugs are typically not soluble in water, but their sodium salts are. The antibacterial activity of sulphonamides is due to the presence of a para-amino NH2 group or an amido group in their chemical structure, which allows them to interfere with the synthesis of folic acid in bacteria. Sulphonamides are effective against a broad spectrum of bacteria, including gram-positive and gram-negative types. Unfortunately, the prevalence of resistant strains has reduced the efficacy of these agents. Additionally, sulphonamides only inhibit bacterial growth and do not completely eliminate infections. To fully clear an infection, the body's immune system plays a vital role in combination with the drug's bacteriostatic action. In simpler terms, sulphonamides work by blocking the utilization of para-aminobenzoic acid, PABA, by bacteria for the synthesis of folic acid. This is achieved by competitively inhibiting an enzyme called dihydroteroate synthase, which is responsible for incorporating PABA into dihydroteroic acid, the immediate precursor of folic acid. By inhibiting this enzyme, sulphonamides prevent the bacteria from producing enough folic acid, which is essential for their growth and survival. This results in the inhibition of bacterial growth and eventually, the elimination of the infection. To summarize, sulphonamides target bacteria by inhibiting their ability to synthesize folic acid, which is essential for their survival. This is achieved through competitive inhibition of dihydroteroate synthase, an enzyme that incorporates PABA into dihydroteroic acid, a precursor of folic acid. Since sensitive organisms rely on synthesizing their own folic acid, sulphonamides are effective against them, while sulphonamides have a synergistic effect with trimethoprim, which is a competitive inhibitor of microbial dihydrofolate reductase. This enzyme is responsible for reducing dihydrofolate to tetrahydrofolate, which is essential for bacterial growth. The simultaneous administration of sulphonamides and trimethoprim leads to a sequential block in the pathway, inhibiting the synthesis of folic acid and ultimately killing the bacteria. This combination is known as co-trimoxazole or TMPSMX and is widely used in the treatment of various bacterial infections. Acquired bacterial resistance to sulphonamides can arise through various mechanisms, such as random mutation and selection or transfer of resistance by plasmids. These mechanisms can result in decreased bacterial permeability or active efflux of the drug, lower affinity for sulphonamides by dihydroteroate synthase, alternate metabolic pathways for the synthesis of essential metabolites, increased production of essential metabolites or drug antagonists, or enzymes that are less readily inhibited by sulphonamides. Increased production of PABA is not always associated with sulphonamide resistance. This type of resistance is usually persistent and irreversible. Once in the body, sulphonamides undergo metabolism in the liver and excretion primarily by the kidneys, with some drug also excreted in the bile. The elimination half-life varies depending on the specific sulphonamide and ranges from 8 to 12 hours for short-acting drugs to 30 to 200 hours for long-acting drugs. Because of their affinity for albumin, sulphonamides may displace other drugs from protein-binding sites, leading to increased serum concentrations and possible toxicity. In patients with impaired kidney function, sulphonamides may accumulate, leading to toxicity. Therefore, caution must be taken when administering sulfonamides to patients with impaired renal function. The ability of sulfonamides to cross various body barriers and reach different body fluids and tissues is due to their distribution throughout the body, bound to plasma proteins like albumin. Sulfadiazine and sulfosoxazole can even penetrate the blood-brain barrier and reach cerebrospinal fluid, making them useful for treating meningitis. However, their ability to cross the placenta in pregnant women can cause harmful effects on the fetus. In the liver, sulfonamides undergo metabolic changes and form N4-acetylated sulfonamide, which is the major metabolite. These metabolites, along with the unchanged drug, are eliminated from the body mainly through urine. In acidic urine, older sulfonamides can form crystalline deposits that may cause urinary obstruction. A small fraction is also eliminated in feces, bile, and milk. Discusses the classification of sulfonamides based on how rapidly they are absorbed and excreted from the body. There are three groups of sulfonamides. Oral absorbable sulfonamides. These are absorbed and excreted rapidly and include drugs like sulfosoxazole, sulfamethoxazole, sulfadiazine, and sulfadoxine. Oral non-absorbable sulfonamides. These are active only in the bowel lumen and include drugs like sulfasalazine. Topically used sulfonamides. These are used for topical application and include drugs like sulfacetamide and silver sulfadiazine. Discusses the classification of sulfonamides based on how rapidly they are absorbed and excreted from the body. There are three groups of sulfonamides. Oral absorbable sulfonamides. These are absorbed and excreted rapidly and include drugs like sulfosoxazole, sulfamethoxazole, sulfadiazine, and sulfadoxine. Oral non-absorbable sulfonamides. These are active only in the bowel lumen and include drugs like sulfasalazine. Topically used sulfonamides. These are used for topical application and include drugs like sulfacetamide and silver sulfadiazine. The slide then goes on to discuss specific sulfonamides in more detail. Sulfosoxazole, for example, is highly protein-bound and has excellent antimicrobial activity. It is excreted primarily in the urine, and about 1/3 of the blood concentration reaches the cerebrospinal fluid, CSF. Discusses the classification of sulfonamides based on how rapidly they are absorbed and excreted from the body. There are three groups of sulfonamides. Oral absorbable sulfonamides. These are absorbed and excreted rapidly and include drugs like sulfosoxazole, sulfamethoxazole, sulfadiazine, and sulfadoxine. Discusses the classification of sulfonamides based on how rapidly they are absorbed and excreted from the body. There are three groups of sulfonamides. Oral absorbable sulfonamides. These are absorbed and excreted rapidly and include drugs like sulfosoxazole, therapeutic uses. Sulfonamides are a type of antibiotic that is used to treat bacterial infections in various parts of the body. They can be used alone or in combination with other antibiotics, depending on the type and severity of the infection. Some of the most common bacterial infections that antibiotics are used to treat include respiratory tract infections. Antibiotics such as penicillin, macrolides, and cephalosporins are commonly used to treat respiratory tract infections such as pneumonia, bronchitis, and sinusitis. Skin and soft tissue infections. Antibiotics such as penicillin, cephalosporins, and fluoroquinolones are used to treat skin and soft tissue infections like cellulitis, impetigo, and abscesses. Urinary tract infections. Antibiotics such as nitrofurantoin, trimethoprim sulfamethoxazole, and fluoroquinolones are used to treat urinary tract infections, UTIs, caused by bacteria. Sexually transmitted infections. Antibiotics such as azithromycin and doxycycline are used to treat sexually transmitted infections, STIs, like chlamydia and gonorrhea. Gastrointestinal infections. Antibiotics such as metronidazole and fluoroquinolones are used to treat gastrointestinal infections caused by bacteria, such as Helicobacter pylori, which causes ulcers. In addition to these, sulphonamides are also used to prevent and treat infections in burns and other types of wounds. They can be effective in treating bacterial infections in the urinary tract, ear, bronchitis, and pneumonia. Adverse effects are the unwanted and potentially harmful effects that can occur when taking sulphonamides or any medication. Sulphonamides can cause a range of adverse effects, including hypersensitivity reactions such as mild rashes to severe anaphylaxis, which is a life-threatening allergic reaction. Sulphonamides can also interfere with the production of red blood cells, leading to anemia. Skin reactions such as rash, itching, or hives may also occur. Sulphonamides can make the skin more sensitive to sunlight, leading to sunburn or rash. Gastrointestinal effects such as nausea, vomiting, or diarrhea can also occur. In some cases, sulphonamides can cause kidney damage or central nervous system effects such as headache, dizziness, or confusion. Sulphonamides can also displace other drugs from their binding sites, leading to increased toxicity of the displaced drug. It is important to note that these adverse effects are not common and may vary depending on the individual and the dose of the drug. If any adverse effects occur, it is important to contact a healthcare provider immediately. Additionally, some antibiotics used to treat bacterial infections can interact with other drugs as well. For example, macrolide antibiotics such as erythromycin and clarithromycin can interact with medications that affect the heart rhythm, such as amiodarone or quinidine, and increase the risk of serious side effects. Fluoroquinolone antibiotics such as ciprofloxacin and levofloxacin can interact with antacids or iron supplements, reducing their absorption and effectiveness. It's important to inform your healthcare provider of all medications and supplements you are taking, including over-the-counter products, before starting any antibiotic treatment to avoid potential drug interactions. Your healthcare provider can help you determine the most appropriate antibiotic for your specific medical condition and advise you on any necessary precautions to minimize the risk of adverse effects or drug interactions. Please kindly subscribe and like our content and share it with your friends as it would greatly benefit our team. Thank you for your support.